Here with Henry's Uncle podcast, where you're always loved, never judged. You got me, Greg.
Eric.
Bobby.
And Jimmy.
And we're here to talk about why we started the podcast and why Eric had the vision and had the wherewithal to make Henry's Uncle organization come to be.
Yeah, so last year, my older brother, James, who was almost 35 years old, I found him passed away due to an accidental drug overdose, primarily fentanyl. James did suffer from a prescription pill addiction that began about 12 years ago. And I worked with him with our family company for the last 8 years in the same office every single day. And never once did I ever expect or even think that he had any sort of substance use issue. I know it wasn't every day. I know he did get clean. But ultimately, the cravings came back, and it ultimately cost him his life. When you start thinking about the opioid epidemic, with the latest record of around 70,000 people dying in 1 year, but then you also really talk about all addiction. It's just not an opioid epidemic; it's an addiction epidemic that is around us and very prevalent. Whether it's alcohol, prescription pain pills, methamphetamine, cocaine, it is a big issue. And it needs to end. People should not be dying at this rate at all. There is evidence-based treatment out there. There is rehabilitation services, and the stigma around addiction needs to end. And when I found my brother, at his house, passed away, the first thing I thought of was, my son, my 1-year-old son, Henry, not being able to know his uncle, James, and how the name came about, Henry's Uncle. That was the first thing I thought of, because I know James, as my only sibling, he was very excited to be an uncle. I know he was uncle to many of his close friends' kids, and he was a hell of an uncle to them, and I'm very jealous of that. But it was my first thought that, my son will never get to know his uncle because...
the addiction epidemic that we have here.
Yeah, of a manufactured pill. Right. And I started Henry's Uncle to help bring awareness to the addiction epidemic, and also to help end the stigma around addiction so people can come forward and seek help and know it's not a moral failure, it's not a weakness, it's a chronic disease. And I thank you three for being here today to help kick off the podcast. And I'd like to go around and ask each one of you why it's important and why you joined.
Sure. So I'm Greg. What really resonated with me about this organization is the fact that our society has so much stigma around just being open about your issues. Whether it's amphetamine or a pill or some sort of addiction, you should be able to openly speak about it, seek help, and there should be vehicles within our communities that allow us to seek help. And that is not happening today. My background's in healthcare. I am no longer in the healthcare industry, but I feel like there needs to be an outlet within my life that I can address some of the inequalities that we see. Another reason why I wanted to join Eric in helping, I remember being at the funeral, and at that moment, just realizing how many people around me have been just afflicted by addiction. I think I'm not perfect myself. I know for a fact that I've had issues myself with being able to partying and substance abuse, but I've been lucky in the fact that I don't have family members around me that are addicted. I myself don't have issues in that same sense, but it's sad to see my friends in these circles that have to go through it. And whatever I can do to support them, to support our listeners, to support our community in making sure, in ending stigma. Really, that's really what it comes down to. Ending stigma and having outlets for those to find and seek help. That's why I joined, and that's why I want to do everything in my power to bring help.
Yeah, so I wanted to join as someone who went through AA and is now sober. I also hate the stigma around calling myself an alcoholic and just alcoholics in general. I don't call myself an alcoholic because of the stigma. And I remember running into you, Eric, at a Target, like downtown, and you mentioning starting this, and I was totally blown away. And in that moment, I was like, I want to do whatever I can to help. And that's probably when I realized I need to do something to give back to this community that helped me get sober. And this is my opportunity to do that.
I'm with Jimmy on that one. I basically, unfortunately, this is Bobby here, got a graduate school level education in alcoholism and mental illness over the last half decade. And I feel like I can put this knowledge to work. For people listening, I've known Eric for a long time, not as long as Jimmy, but we were college roommates for 3 years. I love Eric with all my heart. And I was kind of out in the wilderness for a long time when I was sick. I didn't talk to anybody. I kept to myself. I was in other states. And it just so happens that James's death served as a catalyst for me to reacquaint myself with all my old friends. So it's a weird thing, but on some level, that's why it occurred. Now, I'm an alcoholic. I have bipolar disorder, and I think a lot of people don't know what those people are like. I'm just a normal person. I happen to have different issues, and I think if I just talk openly and candidly, and people get to hear from somebody who has these issues, they might realize that I'm not as different as people might think. And for people listening, if people have problems like that too, I feel good, like Jimmy said, giving back, because it's really the only way that I can stay healthy. And the other thing is, it's kind of a good incentive for me to stay sober, working with an organization promoting sobriety. Go figure, right? So I force myself to do this, really. And I've been forcing myself to do uncomfortable things to stay sober. And I really appreciate it from the bottom of my heart, Eric. You and I share something that most people won't experience. Everyone experiences the passing of loved ones, but not like that in a tragedy. So I'm glad that you and I are fighting the battle together, and I'm here to help out as much as possible.
Thank you. In this podcast, we'll feature people who have gone through active addiction to talk about their stories, how they got into recovery, what kind of treatment they went through. We'll also talk about with people on the policy side as well, law enforcement, people, chief medical officers, people in government, so we can get their point of view as well, because there are a lot of gaps in our healthcare industry, specifically with people who are suffering with addiction. And we want to understand those gaps and try to help close them so more people can end up in recovery and not dying. And
not only are there gaps, but it's very difficult to navigate.
Yes,
and
very difficult.
I believe having people that can speak from all stripes, from all surrounding addiction, should help those have a better sense of where they need to find help, how to find help, and what's being done. What is the state of the union right now?
Yeah.
Is the sense of, we know this is a problem, who's addressing it, and why we're addressing it.
It's a very, complex issue, and in our politically, charged climate right now,
polarizing.
Yeah,
climate.
I want to be able to bring people together, because it is, all points of view. It's a very holistic approach, and we all need to have very constructive conversations, whether you agree or not, but have constructive conversations so we can really truly help everyone.
Yeah, and let's not polarize in the sense that you may have an opinion, but let's come and meet in the middle.
Yeah.
Right?
Yeah.
And have constructive conversation. I really like the way you put that.
Yeah.
I think you won't have as much trouble as you think in that respect, because people do want to make a change and people do want to help. And I think that there's a beginning of a sea change with respect to addiction and mental illness. So it'll be fun to be along for the ride. And look, it's a very, can be at times a very morbid topic, right? We're talking about death. We're talking about overdoses. But the thing is, you got to have some gallows humor. You have to laugh. And it's the truth. So I'll be
Bobby
trying
will
to
bring that
inject
all
a
the
little
time.
humor into this damn thing. Because otherwise, it's not going to fly. So we're going to be serious, but we're going to have as much fun as we can too.
Yeah.
Absolutely.
Thank you for listening to the Henry's Uncle podcast. Please take a second to like, subscribe, or rate us. But more importantly, please share this podcast with anyone who may be interested in the topics discussed so they know they are not alone. As always, at Henry's Uncle, you are loved, never judged.